everybody, and welcome to our webinar tonight. I'm Keisha Ndozo, a member of our customer success team here at Zephyr, located in Calgary, Alberta. Our customer success team oversees facilitating training for clinics to be successful with the MATRx Plus device. We have a great webinar scheduled for you tonight. I will be moderating this webinar with our Chief Dental Officer, Dr. Suresh Sharkandi, and we have some amazing panelists, Dr. Salima Adesha here in Calgary, and Stacey Talbott, the sleep lead from Family First Dental of Storm Lake. We will take your questions at the end of the webinar. Please type them in. So I'm going to get with Dr. Suresh to introduce himself here.
Well, good evening or wherever you are. I think everybody is going to be either in an afternoon or evening right now. So good evening, everyone, and welcome to our webinar. Thank you, Keisha. As Keisha mentioned, we are here. We're excited about having our great panelists tonight here with us, Dr. Datia and Stacey as well. We're going to go through a few questions. We're going to keep this simple tonight. We're going to keep it more of a question and answer and more of a conversation piece. And at the end, we'll have some time to answer any specific questions you may have. The purpose here was to talk to a few of the clinics that have adopted MATRx really well within their clinics and have been very successful in helping their patients with the system. And hopefully from our conversations, you guys will get a few pointers that you can apply in your clinic. And at the end, as I said, if there's any questions you have, we may be able to answer them for you. But without any further ado, I want to go there and talk to the two great guests that we have tonight. Dr. Salima Adatia from Symmetry Dental in Calgary, Canada. And of course, we have Stacey Talbott from Family First Dental in Storm Lake, Iowa. Salima, Stacey, are you both online with us?
I am
Hi
here.
There we go. I heard two yeses, so that's perfect. Why don't I start with Dr. Adatia first? Salima, tell us a little bit about yourself. First of all, welcome. We're glad to have you online with us. And please, thanks for taking the time out of your busy schedule to be with us tonight, of course.
Absolutely, my pleasure.
Yeah, so tell me a little bit about your practice. How did you get into sleep?
Sure. So my practice is just a general dentistry practice in Calgary, and we do all parts of general dentistry. I've been doing sleep for probably 2 or 3 years now. Prior to starting my journey in sleep, we did have several patients who were being treated with oral appliances, but I myself felt very uncomfortable treating them, somewhat intimidated by all the things I kind of didn't really know. And then I had the opportunity to meet with some fantastic members of the team there at Zephyr. I was very lucky to meet with Dr. Remmers and Wendy. And I learned a lot about sort of what the MATRx Plus was able to do and what it could offer. And it addressed a lot of the concerns that had originally intimidated me. And so I felt very inspired by that, and I took a leap. And so now probably 80% of what I do personally in the practice is sleep. So it's been a really exciting journey for us.
And I hear from a lot of people that your story is, of course, an inspiring story, and your improvement over the past few years has been nothing short of just exceptional. And as you said, so you're almost full-time asleep then at this point. You said almost 80% doing sleep.
Yeah, pretty close. I think if I was willing to let go of some of my general dentistry, I could probably get close to being 100%. Wow. But I still like to do some restorative dentistry, so I've hung on to a little bit.
That's awesome. And I do want to come back to that as well and kind of understand how sleep impacted your practice in general. And I think your story will be very interesting, coming from a general practice to almost being an exclusively sleep. But before we go there, I want to get a chance and I want to introduce Stacey to everybody. Stacey, hi. Thank you for being with us tonight. Can you tell us a little bit about yourself and how you guys started the sleep program in your dental clinic?
Yes, I am Stacey Talbott. I have been a registered dental assistant here in Iowa for a little over 9 years now. my doctor is somebody who is very into the technology and how to improve our office and how to grow our office. And one way we kind of came about doing that was by jumping into sleep. We had a patient that was intrigued and wanted an oral sleep appliance, and he actually ended up traveling over 2 hours just to be able to get an oral sleep
Wow.
appliance. He didn't have to use CPAP, and that kind of jump started us, kind of started getting us into the information. We started doing some online training and everything we could find, and kind of did a whole lot of research, and then we were finally able to get a lot of the equipment that we needed, and jumped into it here about a year ago, and kind of got full-fledged going into it here about March. So we're still kind of trying to get everything rolling 100%, but we are headed in that direction.
That's great. That's great. And I'm sure your experience would be very similar to a lot of people that are on the call with us. So I'm sure your input and how you got things started would be very, very valuable for us tonight. But yeah, I was wondering if I can start, and in no specific order. I just like to kind of keep a conversation going. Whoever wants to answer this question first, but what impact has sleep had on your practice? That's very interesting because, as you mentioned, Salima, you were doing general, and all of a sudden, within a few years, you're 80% asleep. So can you tell us a little bit about that? Like, how was it that it changed the way your general practice was being run? And did you notice any difference? How is it different from general dentistry, I guess?
Well, I think it's given the whole team a bit of a deeper insight into comprehensive treatment planning, comprehensive dentistry. I think our staff are seeing patients more holistically now, looking at the bigger picture. And from the practice perspective, it's really allowed us to grow and expand. It's given us an amazing opportunity to find new patients, offer new services, and it's really inspired even the staff because they're able to see the improvement in the overall quality of our patients' lives. It's been so dramatic. It's really inspiring for everybody.
Yeah, no, that's it's funny because you kind of started talking about that holistic approach and comprehensive approach. And that's one of the things that I like to discuss all the time. I feel like perhaps a decade ago, sleep was another entity on its own. So a lot of people had their general dental practice, and then there was a sleep practice. But today, we know the impact of sleep on every aspect of general dentistry as well. And if you want to do, to me, if you want to do, I'm getting a little bit of a feedback here. I'm not sure if it's only me. Brenda, Keisha, do you guys hear that as well? Is there something we can do about that?
It might be maybe Stacey, if I think she's just connected via microphone, maybe.
Okay, all right. I'll just find. But back to the point, it's just to me, sleep and airway has become an integral part of general dentistry right now. The same way that we screen our patients for perio orthodontic problems or anything else, airway assessment is part of that. So I'm glad you brought that up. How about you, Stacey? How has it been in your practice? I know it's new, but you mentioned about the patient that you guys had that traveled 2 hours to come there. How was that for everybody? And I'm assuming that was quite an experience for everyone, but would love to hear your thoughts on that.
Well, he was actually what got us started in the sleep medicine. He had to travel to another office 2 hours away from us.
Oh,
to be
the other
able to be
way.
treated with an oral appliance. And so that kind of got us really looking into things to see if there was something that we could bring into our office to be able to treat people without having to have them go so far away from home. And so we do have a few people that we are in the process of working with and getting an appliance made for them. Unfortunately, we're so new with all of this, we haven't actually delivered an appliance yet, but we have 2 of them in the process. And it has really just made us really starting to grow as an office because everybody's kind of into it. And, you know, we take the CBCT and we check the airway and we're like, well, it's restricted or it's not restricted. and then, you know, we kind of go from there, and just being able to offer that to them through another office.
Of course, and I'm sure the patients appreciate that a lot. It's in a way, it's a differentiator, and it just brings a new dimension to the clinic, as you mentioned, and getting the team together. That's an important part of it, because I feel like dental teams, a lot of times, we always need new things, new stories to stay motivated and excited about the office. Back to Salima, because since you're doing quite a bit, tell me a little bit about the numbers here. Did it impact your revenue at all? Was this something that you feel like it kind of added a new, uh, let's say, revenue stream to your clinic, or how was that for you?
Yeah, absolutely. Because now I'm doing less of the restorative dentistry, I have associates picking up on that side of things. And so now it has definitely added a whole new revenue stream for us. We've been fortunate in that we get a lot of referrals from outside of the practice, but also from within the practice. You know, now that the team is all really well versed and they're screening patients, and it is even building revenue from within, for sure.
No, that's fantastic. Can you tell me a little bit about how your patients actually, since you brought that up, actually learn about your sleep program? I know you get a lot of referrals now, but initially
Yeah.
you said you got a lot of patients through your own. So tell me a little about your screening and what is your in-practice marketing and external marketing, if you do anything. Would love to hear a little bit about that.
Yeah, absolutely. So I mean, we've done the regular things. You know, we've added it to our website. We've placed promotional products, display products within the practice. But we've also implemented sleep screening in our hygiene programs for kids and adults. And that's been a great opportunity to spark conversation with patients. And as we've started treating patients, we've noticed improvements in their periodontal condition, improvements in their TMD, in their jaw pain, in their bruxism. And so that's really kind of, you know, it's been a great word of mouth within family members, friends, and it has organically kind of taken off on its own. And so it's become such a part of the language in the practice that it is as much a part of what we do as oral cancer screening or bite wings, and that has really brought it to the patient's attention.
Oh, that's amazing. And how long did it take your sleep program to get up and running?
So for us, it probably took somewhere between 6 to 9 months. So for me, from the time that I decided to get more involved with the sleep, within about 6 months of starting my coursework, I was fortunate enough to be able to purchase a practice here in Calgary that was exclusively sleep-based. And so that really kind of sped the process up for us. So I would say probably within 9 months, we were fairly busy.
That is awesome. That is awesome. How about you, Stacey? I would love to hear your guys' story, because you guys are a little bit earlier in your journey. So would love to hear where you guys are at. As you said, you're early on, and how are you bringing this up with your patients today in the clinic?
Well, first of all, how we are bringing it up is it is actually part of the health questionnaire that we have every patient fill out when they check in. And so then we kind of get a start from there as far as, you know, which patients to be talking to about it. And honestly, we talk to most of our patients about it, just so then it's kind of, you know, word of mouth, because it seems like a lot of people, well, I don't, but my husband, or, you know, my aunt or my daughter, you know, it seems like they all know somebody that could use the information. We've also really worked on putting displays around the office. We have posters up. We have a TV screen out in our waiting area that runs programs about it. We have brochures up. I run the Facebook page, so I have Facebook page posts constantly about it. And then we have two billboards that get alternated back and forth between in town, that kind of goes from one thing to another, but we make sure that the sleep is on there every few months.
Oh, that's awesome. So a combination of pretty much in-office screening, internal and external marketing, but a lot of it seems to be getting it from people asking for it anyway with somebody within the family, seems like.
Yeah.
That is
Yeah, and
amazing.
we've actually had a lot of, we didn't realize it, but a lot of the medical doctors know that we're doing it and have sent people our way too. So that's been really helpful and, working on trying to get all of that going right now.
That's fantastic. How about your, how's been your Zephyr onboarding? Because you guys have started with MATRx not too long ago. So tell me a little bit about that. Because I know with Dr. Adacha, it's been a little bit longer, but I'm curious to know with you guys getting the MATRx up and running, how long did it take you to kind of get there? How was your experience with the onboarding and the customer success team? I know I have them on here. I'm putting them on the spot here.
My experience with Matrix Plus and Zephyr, I mean, anytime I call Ann, she is readily available. And if she's not, she gives me a phone call back real quickly. If she doesn't have an answer that she feels comfortable giving me, she immediately finds somebody and gets me an answer one way or another. And the program itself has been super easy to get up and going. We actually sent several of our office members home to do the sleep study before we even started doing some of the training. I think we had 3 of them that we sent home to do it with before we even really did a whole lot as far as the training goes. So it's a very easy program to get up and going and get started with, and the customer service is excellent.
That's amazing. I hope you didn't say that because they're on the line with us right now. But
No, I did not.
well, that's great. I'm glad to hear that. Salima, tell me a little bit, since you're more in the treatment, tell me a little bit the benefits of having Matrix, of what you found to be the most effective part of it within your system in terms of treatment.
Yeah, absolutely. Well, I think, going back to how I actually got involved with sleep in the first place, I think for me, one of the most, some of the most intimidating factors were sort of knowing whether or not an appliance was going to work for a patient or not, if it was a good option, a treatment option for them. And then, of course, the titration process. I think both of those things can sometimes be a bit intimidating. And so for me, that really, I mean, the Matrix has really solved those problems for us. It's oftentimes it can be really difficult to ask patients to spend a lot of money on a treatment that you're not entirely sure is going to be effective. So it not only it gives the patient and us, a lot of confidence in proceeding. And then, from a practical perspective, having those diagnostic test results with target positions have really dramatically decreased the amount of chair time and therefore made it so much more productive. With conventional titrations, if you're doing them, if you're not doing them in lab and you're doing them in your office, you could be seeing a patient or talking to them on the phone quite a bit. Here, having all of that information before you get started really it treats the patient really quickly, really effectively. They're thrilled and happy because they're feeling better so quickly. And from our perspective, the amount of time that we have to spend is dramatically decreased. So it's been really helpful.
Yeah, it's amazing how it changes the workflow in general. When I do my courses, I talk about that a lot. It's in a way it completely changes for those of us who have done conventional way of oral appliance therapy. It completely changes the patient flow. It's almost you almost feel like it's not the same therapy, even from that initial conversation. In the conventional way, we used to be talking about, well, did you try a CPAP before? Okay, well, you don't like it. Well, you have an alternative, which happens to be an appliance, that it may or may not work for you. And we may move your teeth and we may move your jaw, but then you got to pay us, but we don't know if it works. And right away, you're almost scaring the patient off. And now just being able to get rid of that unknown and giving the patient the confidence in treatment from the beginning, it's amazing. And of course, simplifying it, right? Time to treatment and is key, right?
Yeah, and I think for novice dentists starting out, I think it's a great way to get your feet wet, because it really helps take the anxiety out of the process.
100%. And this is one of our biggest obstacles in the past. We would train hundreds of dentists, and 2 years later, I would see them, and only 15 or 20 of them would be doing appliances. Then you ask the rest, they're like, I just don't want to do something that I don't know if it's going to work or not. There was a lot of fear. There was a lot of anxiety about the unknown. And We feel like with MATRx Plus, as things have changed drastically there, because it's almost as simple as making a splint in that sense. But going back to
Yeah.
your early days with MATRx, how was your onboarding experience? How was it with you and your team? How long did it take before you felt like, well, I've got this down, this is perfect?
I think it's always, our experience has always been fantastic. I think, we started very early on, and now you guys have grown and are doing more, and the experience has not changed. In the time that I've owned a practice, I've dealt with a lot of different products, and our experience at Zephyr continues to be one of the best that we've experienced in terms of support. There's a real vested interest in our success. And so, any time that we've called, you guys have even taken calls directly from patients to try to help with some of the technical problems that they've been having. So for us, really, once the staff was, once the team was able to really get down the making of the actual trays, which didn't take very long at all. We've been up and running for quite a long time. It didn't take us maybe, I don't know, a couple of weeks. 2 or 3 patients to practice, and they were good to go.
So very similar. Well, that's great to hear. I'm gonna go on the other side. I'm gonna talk to Stacey a little bit. I hear that you're pretty much your sleep team leader in the practice, which is amazing, because we always talk about having a sleep champion in the practice. I would love to hear a little bit from you. Like, what made you first of all take on that role? What motivated to do that? And also, how much does your doctors spend with the sleep patients? Like in our practice, there is always a joke that I don't do anything. I just show up and pretty much do what my team tells me to do. And I like that. I'll take that as a compliment. But I'm curious to hear it from you. How is this role? Are you enjoying it? Tell me a little bit about where is the doctor involved and where are you involved, and maybe the benefits to both the team and the patients. Would love to hear your thoughts on that.
Like I said, I've been with this office for a little over 9 years, and kind of as the time has gone on, I have my doctor puts a lot of trust in me, and I do a lot of things. And so when we went into the sleep, she kind of looked at me and she said, "Hey, I've talked to a lot of people that when they start this program, there needs to just be a sleep team, a sleep team lead." And she goes, "You're going to be that." And so from the very beginning, I kind of just got thrown into it. And from there, we went out and did the 3D dentist training in North Carolina. And that's really what got us jump started and felt really good about doing this. They kind of gave us the information that we needed to have, along with what we had already been given from you guys. So I just, and I go in, if there's somebody that needs to be talked to about sleep, I go into the hygiene room or into the exam room, depending on where the patient's at. I talk to them. We've had a few patients that have actually stopped in just to have a consultation about the sleep treatment. And I set everything up. I set, the home study test up for them and send them home with that. I mean, the one patient that we do have that we're about ready to deliver an appliance on, I honestly think the doctor has seen her a total of 10 minutes, and I've done everything else. But that's something to me, that's one way to help our practice grow and help her better herself too, is to be able to have a team that she can lean on and that she can trust.
Yeah, and sleep happens to be one of those areas. It can truly be 100% team driven, and in a way you wouldn't even have to be touching the hand pieces at all, right? And it's true that the patients tend to believe our team better than they believe us as dentists, and it helps with that patient relationship, of course. That's amazing. That's amazing. Well, you know what? I want to change it around. We've been talking about how easy it is, and I'm sure some of the people that are online, they're like, well, let's talk about the challenges. Let's talk about the hard things that you guys had to go through. I'm going to start with you since we have you online already. What would you say has been your biggest challenges in terms of getting a sleep program starting up? And also in terms of getting the MATRx involved in the program, and how did you kind of overcome with that? How did you address those challenges? Maybe some of these challenges are challenges that some of the other people here online are facing, and I'm sure this would be very helpful for them.
As far as getting the sleep program and the MATRx system, you know, I honestly, we got the Sirona CBCT machine, and with that, we were set. We were told that we were getting this MATRx Plus system, and we kind of all went, "What the heck is that?" um, but like I said, it was very easy. I mean, I opened the box, I dived right into it and started looking up stuff and started trying to get a hold of stuff. And then with that, Anne was getting a hold of me and I was getting a hold of her, and we had things up and running pretty quickly. I would say as far as the sleep program goes, the biggest challenge for us, and we've been told it's kind of our demographics and where we're located, is just convincing people that to spend the money on it, you know, kind of getting them to be comfortable with, hey, this is affecting your health. This is affecting so many more things than, you know, just your sleep. Like, this is affecting your overall health and your well-being, and, you know, kind of getting them in that state of mind.
Mm-hmm. And that's, of course, creating the value for treatment,
Yep.
making sure they understand this is just beyond getting an appliance. And since you brought up the whole topic of money right now, tell us a little bit about how you guys do your medical billing. Is that something that you guys have gotten involved yet?
We actually use a program. It's Pristine Medical Billing,
Yeah.
and they have been very good with us as well. I mean, at this point, now that I've gotten everything kind of up and set up with them, it is a matter of I send a copy of the insurance card and the date of birth for the patient, and she takes it from there, and within a few days, usually I think it's within just a day or two, she sends back to me, hey, this is what the patient is going to owe out of pocket. This is what you need to do. The patient needs to call and set up gap approval, or, you know, when you get ready, send me all the information, and then they submit it for you.
And what would be your advice for people that are on this call with us in terms of when to bring in the billing into the system and what to expect? I think you kind of covered that. It seems to be easy, but would you say it's best to bring them in right away when you start the sleep program up and running, or do you want to wait? Like, what was your guys' experience there?
We set it up pretty much as soon as we set up the MATRx Plus system, because I did not want to be part of trying to mess with medical billing as well as trying to get all this stuff set up. And we actually implemented doing implants at the same time. So trying to set up two very large programs, I did not want to try to set up medical billing. So we brought Pristine in right off the bat. And I mean, like I said, they were very helpful. I think we were part of Pristine for probably a month or 2 months before I even started submitting insurance cards to them. So they were easy to get things going with on my end. Like I said, I'm not part of actually like contacting them and filling out all the papers, but from what I had to fill out, it was very easy.
Oh, that's great. And I do believe at Zephyr, we just announced a partnership with Pristine and Code, two great medical billing companies that we're going to be working with in US as well. So if you want more information on that, of course, contact our customer support team. But Dr. Adatia, since we don't deal with any medical billings here in Canada, and our patients just pay for everything, which is not true. I'm just kidding there. But let's just move away from the money. I don't like talking about money too much. It's about creating value, and that's very important. What would be your advice to a doctor who wants to get started in sleep and doesn't know much about it? Right? Just if I was going to ask you, you're going to look back at your experience and you've had an amazing, amazing growth in this field. What is your advice?
I think, you know, to just sort of take the leap and jump in. You know, I know there's lots of different offerings depending on, you know, what part of the country you're living in, whether it's local events or online courses. And to just find something that piques your interest and give it a try. I think, like many things, I think it seems maybe a bit scarier and a bit harder when you know less about it. But once you do that first course, I think, you know, it's enough to sort of to show you what an amazing impact, you know, you can have on someone's quality of life. And you know, not to minimize what we do as dentists, but generally speaking, you know, you're not able to make that kind of an impact, even doing veneers or smile cases. You're not getting that kind of satisfaction as you do when you've helped someone with sleep. It's just really fulfilling in a whole different kind of way.
Yeah,
So
no,
just jump in and try it.
Yeah, no, and it's amazing how you mentioned that. It is something that until you experience it, you wouldn't know about it, of course, right?
Yeah.
I used to be involved in a lot of cosmetic dentistry to begin with, and aesthetics, and the power of a smile is, of course, unbelievable. What you can do for a patient by
Huge. Yeah.
changing their smile and getting rid of their pain and headaches, it's life-changing. But the moment you start treating their sleep, the term life changing gets a new meaning, of course. And you're like,
It
wow,
does.
it goes beyond life changing. It's in a way, it's life saving. And
That's
it
right.
is amazing how it helps you get the practice up and running, and your team gets very involved, and it just solidifies their
Yeah.
relationship with the patient, and it's just a new
Absolutely.
completely aspect in your clinic. That is great. Stacey, how about
Mm-hmm.
you? If you had colleagues that are other practices and they're reluctant to get into sleep, what would be your suggestion to them? What would be your advice for them?
Honestly, I would say just go for it. I mean, you're doing something to better the patients, and it's something that is just kind of putting more in depth in your office and allowing you to treat the patient as a whole versus, so many people see the dentist as just somebody who treats the mouth, and when you can treat the sleep, it treats the whole patient. So it's just it's something to me that is very interesting, and I have really enjoyed learning so much about this and how it affects so many things.
Oh, that's great. That's amazing. That's amazing. It's just every time I hear these answers, it just makes me happy because 10 years ago you would be talking to many dentists and they didn't even know what a sleep was. They thought we were just making snoring devices. But now we're just hearing this whole comprehensive and holistic approach to dentistry as part of total health and how it impacts people. That's just very, very impressive. Let's dive in a little bit into more technical stuff. I guess I'm going to start with you, Salima. What appliances have you been using in your practice, and what's been your experience with them? And also in connection with MATRx, do you notice any difference between
Mm-hmm.
different appliances, and how does that kind of fall within your workflow from that perspective?
Yeah, absolutely. So I think we've dabbled in quite a few. Not being part of the medical billing system, we do have a lot more flexibility, I think. So we do a lot of Somnimeds, Classics, Flex, Suads. We've done some Pantheras, which patients have really loved. OptiSleep, patients love those as well. We've delivered some Micro 2s with ProSomnus, and just a handful of EMAs, not too many of those. But it's been very interesting because, with specifically the OptiSleep, which is a part of, that digital workflow, we tend not to use the OptiSleep too much in patients who haven't done a MATRx Plus because those straps only adjust in increments of a full millimeter. And so oftentimes patients who come to see us with an HI under 10 are a bit disappointed because that's a bit more difficult to titrate. So from that perspective, having the Theragnostic give the patient a lot of different options, because if we know what that target position is, we will typically set them at that target right away. And so the OptiSleep works really, really well. So certainly depending on, whether they've done the Theragnostic or not, that will sometimes influence which appliance we talk about. But I think for us, the biggest thing has been just learning sort of the individual nuances of these appliances, working with different labs, much like you would when you're doing crowns, just kind of getting to build those relationships with the labs and coming to understand sort of, what each different appliance maybe requires and who it would work well in.
Course. And
so I think with different patients.
Are you finding? Sorry. Yeah, go ahead.
Yeah, it just will work differently in your hands, right, based on how you're doing it.
And are you finding you're getting similar results with them when you utilize it in conjunction with MATRx Plus? You've been getting similar results with different appliances, of course.
Oh yeah, absolutely. You know, whether they're in an OptiSleep or a Panthera or not, or a SomnoMed, we will set them to their target position immediately.
No, that's amazing.
And I would say 90 to 95% of the time, they've had no problem. In fact, they do much better than they do if we try to move them up towards that position.
Yeah, of course. Yeah, I'm glad you brought that up because we looked at that in our clinical trials, which I'm sure you're familiar with the results of that. It's amazing when you combine these different pieces of technology together to create that digital workflow, how it impacts just the quality of care. Not only that, but it actually impacts how more successful it can be. When we did our trials, we noticed that the moment you tend to go to that target from day one, and you're providing therapy for the patient from that day one, they tend to tolerate the appliance better. And a lot of the side effects that we're experiencing, it's not there anymore. And of course, the digital workflow right now, the Simple Sleep Solution platform, it just makes it even more easier and streamlined for a lot of patients. And I like to say, more importantly, for the team, right? That's where digital really, really kicks in, which makes things a lot easier. Having a 3-appointment sequence, being able to precisely scan, being able to use the CBCT and visuals and the um, segmentations of the airway, allowing to have that great communication with the patient and being able to move them along their treatment path and getting a precision made device that fits the teeth perfectly. It's just amazing. I feel like we got into, I personally at least got into sleep way too early. I had to make all the mistakes and now it's just way too
Yes,
easy.
the hard way.
I should go back and restart again.
Yeah.
Speaking of that, actually, if you were to start all over again, what would you do differently, Salima? I'm curious to hear that.
I would definitely have gotten my team involved in the training from the very beginning. So the way I did it was once I finished my training, then I came back and tried to bring the team up to speed. And some team members were fortunate enough to go to some of the courses offered by you at Zephyr, and they had a much better grasp of it than the other team members. So definitely, like we said, it's so team driven. To have invested the time and the money in training the team in formal courses would be something that I would definitely do different.
That's amazing. Stacey, how about you guys? What did you guys do with the rest of the team? Is it only you, or did you put up any kind of a training for your staff and team members within the clinic? I would love to hear that.
There is a total of 9 of us at the office. And so Dr. and I did most of the training, the 2 of us, and then we went back to the office and just kind of went over everything with everybody there and kind of got them into it. But like I said, they know the gist of everything, but for the most part, I really go in and I talk to the patient. I mean, I don't assist a whole lot anymore because I take care of the big cases and the sleep and the treatment planning and, scheduling patients as far as the big treatment and stuff like that. So, really it's a matter of me going in and talking to them. And I do hear the hygienist then, after I've talked to a patient, they'll talk to the next patient and they have a little bit more information as far as what they're doing with the sleep program. But I like the way that we implemented things in our office. It seemed to work well.
Very cool, very cool. Speaking of patient communication, how do you guys actually bring up the discussion and the topic of MATRx in that conversation? I'm curious to hear that because the sleep is one side, right? But how are you utilizing the technology? How do you guys bring up that conversation at all? Is that something that you start in the beginning? Either of you, Stacey or Salima, would love to hear your thoughts because sometimes it's easy to talk about a condition, but how you're doing it differently and why you're doing it perhaps better than others, that becomes a very important factor in the conversation. How do you guys bring up that topic of MATRx, technology, imaging, and the simple sleep solution?
So the one way we kind of start with it is by the CBCT that we take on the patient. We segment the airway and kind of go from there, or the health history, and we kind of cover things from there. And the matrix kind of just gets worked into the conversation as we go. Oh, and by the way, we offer the home sleep study here. If you would like to take it home, we can get that together for you here while you're in the office today, and send them on their way.
So in a sense, just simplifying that workflow for them. If they're ready to go ahead, just get them going. They're excited. You've already connected with them emotionally. And now let's just move forward with the treatment.
Yeah.
That is not much different from anything else in dentistry, I guess. It's just, if they're ready to go, we should just get them right at that moment, right?
Yes, very true.
You spent a lot of time communicating the whole thing with them, and now they know they have a problem. Why bring them back 3 weeks later? Let's just get going from there. How about you, Salima? How do you guys bring up the whole matrix and the advantages of it and all that within your conversations?
Yeah, so I think it's maybe a little bit different for us because I will typically see patients specifically for sleep consultations.
Yeah.
But it is it is a part of our conversation, as Stacey was saying. It's just a part of the workflow for us as well. And we have found that typically once a patient has decided to proceed, if they've expressed an interest in proceeding with the matrix test, they're typically at that point committed to then going ahead with the appliance if they find that they're a responder. So like you said, to keep that momentum going, to sort of get that test moving while they've expressed that interest.
Oh, that's amazing. I'm going to ask a completely different question. I know that we have a few people on the panel right here, on the call with us right now, that they have their matrix units, but they haven't been able to get it started effectively yet. What is your suggestion to that? And for those of them that are doing matrix studies, what is your suggestion in terms of getting it more active in their practice? How could they actually get it going? Let's put it this way. We buy a lot of dentists, so we are known to buy technologies, and we're known to let it in the back of the room to collect some dust. What is your suggestion on that? And how should they get going? I'm going to ask Salima first, but I would love to hear it from Stacey as well after.
I think definitely starting the screening in the hygiene chair has been really valuable for our patients of record. So the hygienist, having a look at the airway, having a look at the soft palate, the tongue, scalloping of the tongue, grinding of the teeth, and correlating how all of those things come together as part of a bigger picture. And then actually just asking them how they sleep and how they feel in the morning when they wake up, and sort of getting that conversation going, and then taking that next step to saying, well, why don't we, get you tested, and to then, once it's become a part of your workflow in terms of, what you're doing every day in hygiene, it just will lead into itself to them to start to use the device.
Okay. How about you, Stacey? What are your thoughts on that? And how did you guys, you said you just opened the box and you just went for it. How do they get over that technology fear? I would like to hear that from you. It looks like you're very eager and you just went for it. But if it was somebody else asking, hey, what should I do, Stacey? What would you tell them?
Well, we kind of did just go for it. That's just kind of the way our doctor is. Like I said, she is very into the technology stuff, and she figures if it's going to be in the office, it's going to be getting used. I mean, it's no ifs, ands, or buts about it. If it's here, it's going to be getting used. We actually went through and started and, did almost everybody in the office in the meantime, and kind of got comfortable doing it that way. And once we did the people in the office, we were pretty comfortable sending everybody home with it. So, it didn't really seem to take too long. We did, like I said, the staff, and I know several of us made our spouses do it. And so it was just kind of a matter of, we just kind of went for it. And
I like that. I like that. It's there. Just go for it. That's fantastic. That is awesome. Well, I'm going to take a little moment here because I can go on for hours with the two of you. I love the energy. I love the enthusiasm, and I'm really liking this conversation, and I can go on, and thank you for your time, of course. I do want to take a moment and see if there is any questions that we have from any of the attendees. We promised them that we're going to leave at least 10-15 minutes open at the end. So I'm going to pass it on back to you, Keisha, and let us know if there's any questions that has come up. that we could answer, because I know we have till 7 o'clock, so I just want to make sure we stay on time as well.
Absolutely, for sure. So we do have a question here. What's the difference between the MATRx Plus and other sleep testing home devices?
I guess I can answer that one. I think that would be the easiest way, since I'm online. Basically, the MATRx Plus is the only device that actually is capable of predicting whether or not an appliance is going to work for a certain patient. So it is capable of doing a home sleep testing like any other device that is out there. However, it has a different function, which we call it a theranostic testing, which is that titration component of the test, which allows us to know whether or not an appliance works for a patient and exactly at what position. And this is the only device that has that capacity in the world. So I hope that answered that question.
Great, that's wonderful. And we do have another question here. Do you have sleep MDs on staff for interpretations?
That I'm not capable of answering. You're the customer support, so you should answer that one yourself.
Sure, yeah. So I can definitely answer that question. So we offer a doctor interpretation network that actually allows clinics to send interpretations to a sleep physician or a sleep clinic if needed. And we also allow for, if you have your own sleep physician or sleep clinics that you want to use yourself, we can easily add that to the portal as well for you.
And is that for both Canada and US, or is that just US only?
No, that's for both Canada and US.
Perfect.
Yeah, and I think those are all the questions that we have here, unless anyone else on the line has any questions right now. You can raise your hand or you can type it in.
Okay, while we're waiting for the questions, maybe I can take a moment for a minute and then just kind of do a little recap of what we've talked about. From what I'm hearing from Stacey and Dr. Adatia Salima at this point is, as you saw, the similarities are just the fact that they just basically went for this. They allowed that team-driven excitement to take over the process, and they took whatever technology and whatever tools that they could use to support that movement and allowed the team to go for this whole program. So for those of you who are online, just go for it. Start helping the patients. The moment you just open the door and you tell your patients about this, the rest will just come together. Don't wait too far. Don't wait too long. There's always, don't let your perfection get in the way of doing this. The more you do, the faster you learn, and the faster this whole program is going to grow for you. And the same way that Salima mentioned, it is truly life-changing for your patients. And for me, it was life-changing for me and for my dental career in a sense. So it is very exciting. It is an aspect of dentistry that we are lucky to be able to provide that kind of a care for our patients. So stay strong, just go for it. And as Stacey said, just open the box and see what's in there and you'll figure it out.
Thank you, Dr. Suresh. So I just wanted to go over our customer success team with you. So those of you who are joining us tonight that already have a MATRx Plus system, we are here to make sure you and your team are successful in sleep. So first, you need to connect with us. Your customer success team here at Zephyr has onboarding program that covers obstructive sleep apnea from the start to how to effectively assign a sleep team leader, roles and responsibilities within the clinic. Our 30-day training plan also covers how to use the MATRx Plus device itself and the patient information portal. We also make sure we challenge you with a goal of not just completing a sleep study, but a sleep diagnostic, which Suresh, mentioned earlier, will tell you if they're a responder or a non-responder to oral appliance therapy and what that target position will be. And we don't just provide training. We want to ensure that our 30-day program leads you on a path to being successful with sleep in your practice. Once you've completed a few MATRx Plus studies and fit a couple of appliances, we can recommend courses where you and your team will learn more about sleep, oral appliance therapy, how to network with physicians, market your program, and set up medical billing. So contacting us, you can contact me directly. I do have my email address there and my direct line, and I will make sure that your assigned customer success manager will reach out to you. Our team will follow up in the next few days to learn more about your practices and how we can help you get started with sleep. Survey, please give us your feedback tonight on our webinar as well. And we've also recorded tonight's session, and we will follow up in an email with the information. And I just wanted to take it back to Dr. Suresh here, just to talk about his upcoming MATRx Plus courses.
Yeah, no, for sure. I won't take too long. I just want to kind of talk about these two courses that we're doing. These are brand new courses that I kind of put together specifically for the people that are already using MATRx, but they want to take their practice to the next level, or people that have gotten the unit, but they're just struggling with how to get a program started around the technology. I do a lot of training, of course, about sleep. We have hands-on mini residencies and all that, but this course is specifically designed for MATRx Plus system and fully digital workflows for oral appliance therapy. It includes the simple sleep solution workflows, which includes the imaging and intraoral scanning and intraoral scanning alone. So different pathways of that. It is the first time we're providing this course actually in US. We decided to choose a couple of nice locations. One is going to be Miami. If you're somewhere cold and you want to have a nice little vacation, that may not be a bad location. And also in the next one will be in Beverly Hills in Los Angeles as well. It's a 2-day course. We'll review all the technical aspects of MATRx Plus, but most importantly, how to create a workflow within the clinic. It's a step-by-step almost implementation guide, which really dives into the practical aspects of dental sleep medicine once you have these digital technologies. So of course I will be biased, but I highly recommend it if you have the MATRx Plus and you want to take it to a next level. We also, I believe there is a code that you could use for people that are on this call that would give you a $200 discount for registration. I believe the code is ZST, standing for Zephyr Sleep Technologies, all in uppercase 2019, and it will allow you to get $200 discount. I believe the code expires by October 15th, but Keisha, maybe you can send that in the follow-up email as well. To register, you can just go on our website, charkeducation.com. And if you have any questions and if you want to have more information on that, you can email us at events@charkeducation.com, or you can email me directly at suresh@charkeducation.com. Love to see some of you there, and it would be a great event.
Wonderful. Yeah, I can absolutely send that code to them for sure and make sure that they get it. Well, thanks everyone for attending today, and have a wonderful evening.
And I want to thank Dr. Adatia and Stacey, both of you, for your great input, taking the time out of your busy schedules and helping our attendees here. And it was a pleasure talking to you both.
Thank you.
Thank you.
Good night, everybody.